Welcome, everybody, to our ongoing series of CAHRS webcasts. Today, I'm really excited. We are featuring two of our spring RAs and the research that they've been working on since the end of January. The two RAs that are joining us are Janani Ramesh and Jillian Rogers. And in a few moments, I'll ask them to kick us off and just give a brief description of their findings and the research project itself. But before that, I just wanted to set a few rules of the road. So first off, we want to try and make this as interactive as possible. So if you have questions at any point in the presentation, please just scroll down to the bottom of your screen. You'll see the toolbar on the bottom, and to the far right, there's a Q&A button. You can just click on there, and I'll be monitoring questions throughout. We'll take questions throughout the presentation, as I said. I'll try and filter those into the RAs throughout the presentation as closely to the time when they spoke about the issue as possible. We plan on roughly about 45 minutes or so for the total presentation, including the Q&A. So again, make sure you get your questions in early. And with that, again, I'm really excited for the students to share their research, and I'm going to turn it over to Janani and Jillian to start us off, again, by talking about their overall research project and their findings.
Thank you so much, Chris, and a very warm welcome to all of you. We're excited to be here to share our research findings with you. But just before we dive in, I want to give you a quick context and a preview of all the things we'll be discussing today. So when we started our research project 3 months ago, we were motivated by the growing recognition and acceptance for mental health that has slowly taken place in the last few years. We're seeing more and more employees and leaders talk openly on different platforms about their mental health challenges. And coincidentally, some of the organizations that are joining us today are observing Mental Health Awareness Month throughout May and using this opportunity to tackle the stigma around mental health. So given all of this positive attention, this is a significant moment for HR to leverage the visibility to build momentum and create sustainable impact. So with this focus in mind, we'll spend the next few minutes just briefly going over the research methodology, and then we'll discuss some of the interesting findings that came up in our interviews with the CAHRS partner companies. In our second section on the key findings, we'll first discuss the opportunities for HR leaders to focus their efforts so that they can create quick impact in the short run. These opportunities are focus areas or playbooks where solutions are both easy and quite practical to implement. And after that, we'll dive into longer-term challenges, which include systemic issues. And these are issues where individual companies have limited control. So in our understanding, the long-term challenges are distinct from the opportunities because they require greater resource investment and extensive collaboration to achieve measurable results. And even though a straightforward solution might not be apparent, HR leaders should be cognizant of these long-term challenges as they design their well-being strategy for the future. Finally, we will discuss our recommendation, which is called the 3P framework. It's an original forward-looking framework focusing on 3 pillars of prevention, personalization, and promotion. This framework is our interpretation of what a proactive approach to well-being should look like in the future. So going forward, we'll spotlight only the main insights and takeaways for each section. And if you're interested in the background or more detailed analysis for any topic, you can go back and read our white paper, which is coming up soon. We'll be taking questions during the webinar, so please send us your questions through the chat box. So to better understand the evolution of our well-being strategies, we conducted interviews with 23 CAHRS partner companies across industries. Our 33 participants were global HR leaders with expertise in compensation, benefits, and wellness programming. We followed a structured interview process, which means that all participants were asked a standard set of 8 questions with different types of follow-up questions depending on the company we were speaking to. We analyzed the interview data using qualitative research techniques, and we began to uncover some interesting findings. So we observed 4 big trends in our interviews that informed our recommendations. To summarize these trends, the most consistent view was that there is a greater responsibility for employers to support well-being, not only in the workplace, but also beyond. As many of you know, remote and hybrid work environments are presenting a new challenge because it's difficult to identify personal challenges outside of a work context and find a tangible way of supporting those needs. We also observed that all companies agree on a holistic outlook for well-being. Mental health is just one aspect of well-being and as important as other aspects such as physical, financial, or social well-being. And because well-being has so many dimensions and it has multiple stages, it makes sense that a standalone intervention would not be as effective as an integrated approach that meets employees at the stage where they are. Another trend is that a reactive approach will be less successful than proactive approaches. We have heard mixed reviews about employee assistance programs or EAPs. Most participants believe they're essential, but they constitute a reactive strategy at the most. On the other hand, the companies that have introduced new screening tools as part of newer types of EAPs are reporting a significant turnaround in anxiety symptoms. So overall, there is a trend that companies are moving away from traditional EAPs to new providers that offer screening tools, resilience training, and continuous education as part of their package. Finally, all the participants we spoke to have agreed that to achieve long-term impact in the area of well-being, companies need to embed well-being into how things are done at the workplace. Well-being is still relegated to HR, and outside of the HR function, it's still viewed with a cost-centered mindset. To build the right support system, we need to adapt both the structure and the culture of a company. We consistently heard that role modeling from the top will have the maximum impact for turning around a work culture in the interest of building a mentally healthy work culture. Now let's move on to the 3 opportunities where HR leaders have maximum scope to take immediate action. The first opportunity is tapping into the rapid innovation in the healthcare market by exploring different vendors for EAPs, health programs, and digital solutions with a sharp focus on selecting a portfolio that's best suited for your company. The second opportunity lies in moving away from a traditional one-size-fits-all approach to the benefits model to one that is more individualistic and tailored to employee needs. And thirdly, we recognize that mental health has received a lot of public attention lately, but there's so much work to be done in this space. Stigma continues to be prevalent in many workplaces, and it affects employees' abilities to come forward and seek treatment and ask their managers for support. Now let's consider the first opportunity. There is a plethora of new options available to well-being leaders. There are at least 50 to 60 new vendors for employee assistance programs alone, and hundreds of digital apps and tools. Most participants in our interviews had experimented with different apps for resilience training, telehealth, and digital coaching. So all of these new solutions have similar claims. And these claims are on the order of providing a better employee experience or a higher quality of care. And this is in comparison to the traditional plans that companies already have. But at present, there isn't a reliable way of assessing these claims or a reliable calculation of the ROI of these vendors. So overall, we know that digital innovation can offer tremendous benefits, but this rapid pace of innovation is making it challenging to keep up with the new offerings. How do you evaluate a new vendor and assess their credibility? Some other points to consider include duplication of resources, users' data privacy, and integrating new platforms with existing benefits. To sum up with an example, suppose an organization wants to introduce a new app for mindfulness training that has been rated highly by a certain employee demographic within the company. Then what is the business case for this app when the existing healthcare provider already offers some type of meditation training? And how do you calculate the ROI for the supplemental offering in addition to the existing benefits? What are the risks in sharing all of this data with an external partner? And finally, what's the best way to consolidate old and new resources to offer an integrated platform rather than fragmented solutions that can overwhelm the user? As you can see, the crux of this issue is that rapid digital innovation could complicate healthcare for employees instead of simplifying it if it's not done correctly. Moving on to the second opportunity, we have heard over and over again that there's no one-size-fits-all approach to well-being. When we ask companies to share the top mental health concerns by employee subgroup, there were few overlaps in mental health needs. Individual needs depend on so many factors, such as age group, region, job role, culture, etc. We also know, because of the experience from the pandemic, that an external stressor will affect employees very differently depending on their socioeconomic situation. Some of you may be familiar that the traditional approach towards benefits has relied on the 80-20 rule, which means designed primarily for the majority 80%. So the rationale here is that focusing resources on majority needs would yield the best outcomes in the most cost-effective way possible. But this approach isn't keeping up with the times because it doesn't serve the needs of specific groups, such as employees with children, people with aging parents, and in some cultures, single employees who live with their parents and extended families. Other points to consider include the growing segment of Gen Z workers and new hires who are at greater risk for social isolation. We also know that frontline and hourly workers are more likely to experience financial stress, whereas salaried workers and caregivers are more likely to experience burnout. So if you're moving away from the old model, what should an old model look like in implementation? In companies that have a dedicated team for custom approaches, we're seeing opportunities for employees to self-identify as part of a high-risk group while ensuring privacy and confidentiality. After this self-identification process, employees are automatically sent emails about the mental health resources most relevant for them, and some groups are automatically made eligible for extended paid time off. We're also seeing financial literacy trainings in onboarding programs for new hires. In global companies, there's a trend towards decentralized wellness programming that's being led by human resource business partners and wellness champions at the grassroots level. Then there are many companies who are switching to vendors with a strong presence in local markets and engaging content that's available in multiple languages. So overall, we recognize that the traditional centralized benefits model has been around because it offers many advantages, but a staggered approach to localization can offset the higher costs through improved engagement and utilization of mental health resources. The third theme is the pervasive stigma around mental health, which makes employees reluctant to use the resources available to them or ask their managers and colleagues for support. Stigma is not the same as a lack of resources. It's a self-imposed barrier resulting from cultural perceptions around mental health. Stigma also occurs at an organization level when fewer resources are invested in mental health compared to other aspects of well-being, such as physical health. But stigma differs by culture, country, demographics, and other factors. So a global awareness campaign that takes place once a year may not achieve the desired impact for reducing stigma. There's a need to work closely with employees to create engaging communication campaigns that resonate with the target audience. We've heard of companies implementing stigma-reducing campaigns, and some of the effective components of such a strategy looks like a focused campaign with relevant messaging and a high recall value, or a stickiness component of where employees are emotionally invested in the campaign. Such a campaign requires a comprehensive communication strategy with a balance of digital and non-digital platforms. Use creative posters and booklets to reach frontline employees who may not always be at their computers. Thirdly, educating managers plays the single most important role in reducing stigma because a company could have generous benefits such as paid time off or extended work from home policies. but employees may be reluctant to approach their managers for these benefits. To create a psychologically safe workplace, have open conversations on difficult topics, bring up current events and how team members are coping with them. And this can also help employees to be more self-aware and start balancing their work-life priorities. Another important point is that culture always starts at the top. So when leaders talk about their personal stories in town halls and team meetings, it can encourage employees to be more self-aware and comfortable asking for help. So at this point, let's pause for a bit and take up some questions. Chris, I think you're on mute.
Sorry, I've only been working on Zoom for 2 years. So one of the questions that came in is around this, a little bit of shock actually around just how many options there are, both in terms of providers and all the apps. So any thoughts that you can provide them in terms of how can they evaluate all the different options? Are there ways to think through and assess which options are the right fit for them?
Right. That's a great question. And currently, we do not have a widespread consensus about what this evaluation process should look like, because this is a very new domain and there are so many different vendors for not just for EAPs, but also for digital apps. But we do have some idea about what the basic components should look like. And these basic components are about the trust and reputation of the vendor, then confidentiality of users' data, and how engaging is the content and how up to date is their content. So these are some basic components, and every company can have a more advanced evaluation checklist, which really depends on their experiences with the existing providers and what is the company size and what are the needs of the employees. So we have discussed this in detail in our white paper, but just to sum up, there are two differences in evaluating EAPs and digital platforms. For EAPs, what most companies should look for, and that's what we've also heard that a lot of companies are looking for, is quick turnaround times for appointments and ensuring a very seamless experience for employees at a time of crisis when they're looking for help. So one respondent said, we want to make sure that employees are not doing any homework at all, and we are doing it for them and making the process as easy as possible. For digital solutions, there are a lot of apps which are similar. So while deciding between two very similar apps, the deciding factor is usually creative pricing and their ability to localize content. And localization doesn't really mean the same content in multiple languages. It has to be a more creative approach where they have a pulse of the local markets and which topics are most relevant for them, and creating original content that will appeal to them. So vendors that are able to provide that kind of next level localization are usually preferred to other apps.
Great, super helpful, thank you. Second question, and a few people are asking about this, is given the nature of how work has changed, more people working from home, quite a few people working more hybrid, anything you've saw in this in terms of this personalization and differences in either spotting people who may be having mental health challenges or issues from the work at home population or the hybrid population, any way to think about how to flex some of these practices, policies, tools to that particular audience of the work from home or the hybrid employee?
Right. That's a great question. And I think this is where having a very proactive approach and planning helps instead of having a reactive strategy to well-being. So planning looks like, for instance, I could relate this to the return to work, and a lot of back and forth has been happening in terms of return to work plans. And the companies that were most successful in having a turnaround in anxiety and other symptoms were able to anticipate the rise in mental health concerns after employees would return to work, and they were also able to gauge which employee segments would be affected the most. And depending on that, they personalized their outreach, and employees were given enough support to choose the kinds of solutions that would help them. And this led to a significant decline in, I mean, this was kind of a successful strategy. So I think the same approach applies to hybrid and work environments as well, where well-being leaders are taking a proactive approach and thinking one step ahead to anticipate problems and using data to reach the employees that will be most vulnerable.
Great. So there's a couple more questions, and I think you may get at these in the 3 Ps. So you can tell me if you want to hold off on these. So there's a couple questions around kind of the US-centric nature of many of the apps that are getting created, and your thoughts on how to make them more globally relevant. The other is really around how to make this more of a culture imprint so that we're changing how people work, rather than just trying to reactively address stress and anxiety and things like that. Do you want to hold on those and come back in the 3 Ps, or you want to take them on now?
I think I can give a quick answer for that.
Okay.
So to address both of these, I think there were 2 parts to these questions. And as part of our recommendations that we'll discuss later, support and training for managers will be the most crucial aspect. And working closely with managers and business unit levels at the regional level, at the business unit level, at globally. So that's extremely important, and well-being needs to move beyond HR and have a collaborative approach in order to make this model succeed. So that will be part of our recommendations, and I think that will, to a large extent, answer these questions.
Great. Okay, so I know there's some more questions coming in. I'll make sure we get to those soon, but I want to, just for sake of time, make sure we get on to the next section.
Sure. Well, so yeah, Jillian, I'll hand it over to Jillian, and yeah, this is a very interesting part about long-term challenges that HR leaders should be cognizant of.
Thanks, Janani. And so now we'll discuss the challenges, or otherwise said, what's keeping you up at night? And these challenges have no straightforward solution at the moment. They're going to take longer to address, and we'll need more collaboration, innovative ideas, and discussion. And the 3 top challenges that we identified based on the interviews were employee access to the mental health care system, increasing employee awareness, and defining and measuring success. So first, let's recognize mental health is a very wide spectrum. Some employees just need a day off. Others need to speak with a mental health professional. And it's widely acknowledged that even before the pandemic, there has been a shortage of mental health care professionals. So be aware that you can increase your employer-sponsored mental health resources and spend and increase your budgets, but that doesn't guarantee employees access to treatment. It's also recognized that you are not a therapist, and neither are any of the managers or your coworkers. So when designing a total reward strategy, recognize that part of the root problem, which is the shortage of providers, is beyond HR practitioners' control. What is in your control is mitigating the barriers to helping employees access treatment when they need it through work design, and have an awareness of the access challenges that employees are struggling with, so you can work with your EAP and healthcare providers to mitigate those barriers as much as possible. Consider how managers can work with employees on making space in their work schedules or shift picking that allows them the ability to go to an appointment. Or if an employee needs a quiet place to have a telehealth appointment, is there a private area in the plant or in an office that the employee can go to? If there's unused computers or iPads, could that be plant designated for a telehealth appointment? Because not everyone has and can bring these devices to work. Another idea that came up in interviews is consider auditing your EAP and health insurance to better understand what access looks like from their perspective and from the employee perspective. So what's the average appointment time? We've heard of EAP vendors offering guarantees on appointments within certain timeframes, or vendors hiring mental health professionals directly rather than contracting out. Unfortunately, this has and will continue to be a long-term problem that needs more collaborative solutions. The next is increasing awareness. Regardless of company size or the type of organization, we heard across the board that engaging with employees about their benefits and the resources was very challenging. And as we know, people typically don't listen or don't take note of what resources are available until they need them. When employees remain unaware of the different benefits available, there's a plateau in resource utilization. Then there's a disconnect between actual employer efforts and perception of those efforts, which results in low engagement scores and inaccurate surveys. Increasing communication is not the answer. We've heard over and over again that employees are struggling with digital overload. So consider focusing on the idea of approachability and evaluate the accessibility and navigational ease of your benefits information. To share some ideas that surfaced, consider creating a very, very easy to use benefits website where employees can go to the website, type in their symptoms that they are experiencing and an item that they're struggling with, and a list of resources pop up. Often they go to these websites and don't know what to look for. Or have a network of mental health allies that employees can go to for questions. Consider how approachable these individuals are and how they can connect with employees in a private place, not a busy cubicle. You could place QR codes in very private areas like restrooms or break rooms that link to benefits resources, and explore all cross-functional communication channels. If there's an engagement-related event going on, can you get a manager to attend? Role modeling can increase attendance as well. Taking communication into existing resources that are beyond HR communication channels can be helpful, but it doesn't solve the problem. We heard some good success with it, but it's not a one-size-fits-all. There are a lot of good ideas, but no one magic solution. And the last is, how do we define and measure success? What does success mean when the concept of well-being itself is a broad spectrum that is highly subjective? How do you measure if the baseline is subject to change and differs depending on where a person is within this wide mental health spectrum? What outcomes are you trying to achieve? I could go on with divergent questions on this topic. We heard so many different approaches. So I'll share some pros and cons for using some of the standard metrics that leaders reported using. You can track EAP and resource utilization and engagement, and participation in wellness-related initiatives. But be aware that utilization rates could also be a lagging indicator of success. If use is high, is there a systemic problem within the organization? If it's low, do you just have a really healthy workforce? Engagement also doesn't translate to solutions, which is access and help. Employees can be identified by looking holistically at, trends can be identified by looking holistically at health, pharmacy, EAP, disability claims data. The challenge is that this data is only available in certain countries, and claim variables differ widely depending on whether the employee is in a public or private healthcare system, which differs globally. There's also a lot of privacy concerns to be aware of. Exit interviews and engagement or poll surveys can be a good way to measure perception and success. Yet, fear of employee retribution always hinders survey accuracy. Broadly, we all want the same outcomes. You want to make the business case for your strategy, and you want employees who are healthy, productive, and engaged. So far, there's no consensus about a magic metric to achieve this. And at this point, I will pause and take questions.
Super, thank you, Jillian. So one of the big issues that companies seem to be wrestling with is they've engaged healthcare providers to help them with these services or EAPs, but there's an overall struggle with the access to mental health care providers. There's just a shortage nationally, globally. So any thoughts in terms of how companies might look to address that shortage issue of just getting access to providers for their employees?
Sure. So a few thoughts. Let's first dive into why there's a shortage. So healthcare providers don't accept insurance plans, sometimes due to low reimbursement rates. they don't accept new patients, or their provider is not in proximity to the patient. And telehealth can increase access, and it's definitely helped achieve that, but a shortage of providers, you still have lagging appointment times. And that results in employees going out of network and paying a lot out of pocket to get help when they need it. The next is recognize that it's a heavily licensed profession, which is regulated by the provider state. So the ability to practice telehealth depends on where the person is. If this is a person in the US. So it depends on state laws and interstate compacts. So from an HR perspective, the best thing to do is to be aware of these challenges and how access might differ across states for your US population and globally as well. And so, for example, there are parts of Texas that are considered a mental health care desert with very limited providers. So if you have a large employee population in some of these areas, ask your EAP about the quantity of providers across certain regions and what the average appointment time is, what access looks like. And also you can inquire about what their recruiting strategy is for working with providers, so you have an idea of what the pipeline is when employees need it. You could also work, another idea is you could work with your policy or lobbying team to advocate for reduced occupational licensing laws at the state level. So there more providers could practice telehealth across state lines and hopefully increase the pipeline.
Great, super helpful. Second set of questions, particularly as a couple of the questions have come in, have noted that, you know, the issue of stigma, people's willingness to take advantage of all these great options you're talking about, companies being able to provide, are maybe worse in some locations, whether that's plants, frontline facilities, maybe relative to corporate offices. So how did you guys hear about, or what have you heard in terms of how companies can both increase access, but at a time when maybe employees are more hesitant, or situations where employees are more hesitant to take advantage of those resources? So any thoughts on how to bridge that gap between access and stigma?
Yeah, absolutely. And so Janani spoke of some really great stigma reducing strategies and campaigns, communication campaigns that can help reduce that. And it really comes down to perspective shifting and change management. And there's 3 levels. Use the personal level, the company level, and the societal level. And as mentioned earlier, there has been a lot of public attention in this topic from a public perspective and in the news and in the media. And so at a societal level, it's helping to address that stigma. And from your perspective, you can provide all of the top tools and resources for employees to use. But employees also need to have that sense of personal responsibility and self-awareness of what they need to be successful, to help and hinder success. And so it's a little bit of the yogi in me talking, but it's the yoga teacher in me talking. But if you have that self-awareness and you can get the employee to achieve that, then stigma is much easier to break through. And then the second part of your question, in terms of how to look at it across, you know, different work platforms and different types of work environments, we heard some unique things. We heard that leadership advocacy and sharing anecdotal stories was really helpful. And then we also heard that at a plant level, getting celebrity endorsements and working with people in the community outside of the executive teams resonated more when they shared their stories. And Janani, please feel free to jump in if I'm missing anything else.
Yeah. In addition, I'd just like to add that in implementation, a stigma reduction strategy for plans could look like first approaching the managers and giving them the tools and resources, and then supplementing it with both online as well as offline tools. So it's a multi-pronged approach where there's training as well as extensive communication that's happening to ensure that all employees have access to the awareness campaign.
Right. So there's a few more questions, but both of them, at least from my knowledge of your presentation, I think you're going to address next in the 3Ps. So why don't we move on to that, that phase of the presentation, and then if we haven't cleared those up, I'll ask you some more questions.
Great. So now we'll introduce our framework for HR leaders to move beyond a benchmark reactionary approach to a proactive strategy. This was informed by our learnings from interviews and a systemic review of employee well-being reports. Our framework is called the 3Ps. This encapsulates what the future of well-being should look like: a mental health and well-being approach focused on prevention, personalization, and promotion. In the next few slides, we'll dive into the components for each of these 3Ps and provide some action items and examples for implementation. So the first is prevention, which refers to shifting gears away from reactionary interventions toward cultural change, lifestyle management, and continued learning. Connecting this back to what we discussed earlier in the presentation, this helps to address the 3 challenges, which is access, awareness, and success. It also emphasizes the idea of that personal responsibility, ensuring that employees are self-aware and taking action and advantage of the resources that are being provided. So on the right, you'll find a checklist of items to consider when focusing on prevention. I recognize there's a lot of text on this slide, and so you can refer to details in our upcoming white paper. But for now, I'll quickly highlight the checklist, and then I'll walk you through some key points and examples of how you can create and apply actions to support each pillar of the framework. To have a preventative approach, make well-being a priority at every level of the business, have clear ownership and accountability mechanisms, get leadership buy-in and advocacy, create sustainable workflows, and improve access and resources. Let's dive into number 1. Make this a business priority at every level. So first, clearly define your objectives. Consider what data you have or what you need to make the business case. Are there data models that are typically beyond the HR that are beyond the HR spectrum, such as risk prevention or predictive analytics, to gain a better sense of what variables can be applied in this space? Do you have a portal for employees to submit comments and anecdotal stories? Submissions become qualitative data, and that's really useful to show impacts. At the mid-manager level, incorporate well-being topics of conversation in performance and professional development plans. Another example, number 4, create sustainable workflows. This can be translated to better understand stressors across time zones, business units, and shift schedules, and then consider how you can help mitigate these barriers. So for example, have company-wide awareness of holidays that are regional or cultural specific, and be very mindful of scheduling company-wide events around these dates. We know that sleep impacts health, so ensure that managers are working with employees to pick shifts that are healthy and sustainable. So that doesn't mean 3 night shifts followed by 2 early morning shifts. In the long term, that's not sustainable for your employees. And then identify and be vocal about unintentional stressors. So a 7:30 a.m. meeting, not a big deal for me, but I know that my colleague has to take her kids to school at that time, and that's going to be stressful for her. The second pillar of our framework is personalization, which refers to an overhaul of the traditional benefits model to address individual needs. And so connecting this back to what we discussed earlier, this helps address 2 of the opportunities: the growing number of innovative vendors and unique employee needs and situations. So to create this personalized experience, recognize it's not a one-size-fits-all approach, identify and remove barriers, create benefit programs that are culturally relevant, ensure it's a cross-functional effort, and promote psychological safety. We discussed the first point before, and to provide some additional in-depth examples of how to think about this. Recognize that comorbidities impact behavioral health. So work with your vendor to offer cross referrals between programs, or create non-traditional programming topics in collaboration with ERGs, such as fertility or pediatric health. Another example, number 3, emphasizes cultural relevance. Interview respondents spoke of US-centric resources that were translated for global offices, which we discussed earlier. And these approaches, this just translating doesn't resonate. So consider asking employees in those regions and in those offices what their needs are. You could do this via a focus group or a survey or a hybrid of options, and therefore you're not wasting your time when you implement new resources. You could also consider decentralized programming led by regional HR business partners, ERG, DEI groups, and volunteer networks. At the business unit level, ensure that managers have an awareness that they have the autonomy to create and adapt programming to their business needs. And to clarify, personalization does not mean more costs. Identify what the biggest return on investment is, invest in those approaches that have impact, and eliminate the ones that don't. And lastly, I'll pass to Janani to go over the final P.
Thanks, Jillian. So our final P is promotion, which refers to an innovation in outreach and communications in a manner that all employees are aware and actively engaged in building a culture of mental health. So promotion helps to reduce stigma, and it addresses the remaining barriers between employees and the resources that are available for their care. In our checklist, first I'd like to highlight number 2, which is to promote wellness through multimodal communication channels. This means that resources and information are available in a variety of different platforms, such as digital, print, and in-person contact points. We have touched upon this before. So in implementation, how this could look like is having a dedicated social media page or an email handle that's managed directly by the benefits team. Then supplement online communications with home mailers to reach employees who are in plants, who may not always be at their computers. Often family members and dependents on healthcare plans do not have access to internal channels. So one idea is to have an integrated wellness platform with chatbots and remove firewalls in some sections of the website to provide easy access for family members. An in-person communication strategy needs a large network of motivated volunteers or wellness champions outside of HR. They don't necessarily have to be experts on mental health, but people who are passionate about the topic. To keep all volunteers motivated and engaged, we need to make rewards and recognition fun. So this can look like small gestures, which are usually overlooked, but these are easy to implement and they hold value for employees. Some popular ideas we've heard include mental health ally badges or email signatures like mental health champions. And we can also provide a platform where employees can share how their colleagues or managers have stepped up to support them, such as in town halls or meetings. Managers can also lead by example by plugging in the resources they found most useful or relevant in team meetings. Another effective solution is providing a continuous stream of easily digestible information to managers and employees, such as bite-sized podcasts, a few talking points or tips, and short webinars on topics like sleep hygiene, nutrition, parenting, etc. Next, let's discuss point 5, which is creative incentives, also known as how to make it fun. So consider offering wellness stipends to allow employees some autonomy to spend on physical, mental, or financial well-being needs, such as student loan payments, audiobook subscriptions, or yoga membership. This also strikes the right balance between employer responsibility for well-being and the personal, and giving individuals enough autonomy to select what's right for them. And we could also have an internal business unit challenge, which is quite common these days, that is beyond the traditional 10,000 steps per day competition. Some ideas include 5-minute daily meditation challenges for 2 weeks, or creating and sharing a healthy recipe that can be distributed among the teams. So whatever you choose, make it easy, fun, and simple so that everybody can participate, not just in a particular region, but worldwide.
Great. So a few more questions, and then we'll wrap things up. So the first is really this confluence of personalization. At the same time, companies have their own cost restrictions. So really, how do you think about a company being both efficient in terms of their overall spend on mental health and well-being, at the same time offering lots of personalization for employees?
Right. This is a great question, and there are many ways there is no one right way to do this. So one way could be to take on a portfolio of solutions that is cost effective and give employees enough autonomy to select among those portfolio of solutions that is most relevant for them. Then another cost-effective way to strike this balance between personalization and cost is to consider whether you need a global provider or a global provider who has local presence, or you want to decentralize your program and into different local vendors in different markets. So we have seen both approaches working because sometimes global vendors with a global presence can do a great job, but local vendors who only operate in certain markets could also be an effective option, but that really depends on different companies' experiences. So these are three different ways in which companies are trying to strike a balance between personalization and remaining cost effective. And I also want to touch upon that personalization doesn't need to mean, it's a misconception that personalization means expanding offerings and making it extremely expensive for the company. It could be as simple as rethinking the old benefits and whether they continue to be relevant. Like, is the universal gym membership still make sense for our employees? And why are we still continuing with that? And removing that, and in place of that, more relevant benefits such as flexible work hours or greater childcare, and more innovative options that employees really need in the present.
Yeah, can I just to add to, based on our interviews, the largest organizations with the biggest budgets didn't achieve greater results. And so we mentioned a lot of strategies in the webinar that are very low cost or cost free, and the cost is your time and mental space. And so depending on, no matter where your budget or starting point is, you can still move to personalize in some way.
Great. I mean, it sounds like part of your answer as well is that, as you personalize, you might get much higher uptake and greater usage of the programs by the people who need them the most, which actually creates a benefit on the other end, which kind of changes the ROI calculation. One last question, then I'll ask you guys for your final concluding thoughts is, you seem to be also, as we've done more frequently in the last decade, we're asking managers to be more and more engaged on this topic, just as we are with asking frontline leaders and managers to help do lots of other things. So how do you create the space for them to do this work? How do you help them be more prepared to do this work? How do you get them to buy into yet another training program that they have to go through? So just any thoughts that you have in terms of, how does this actually impact leaders, managers, and are they ready for this?
I can start us off. So we talked about multimodal communication channels before. So make it as easy as possible for them to receive information, whether that's talking points for them to integrate into their weekly meetings, a quick 5-minute podcast they can listen to on a walk, or a short webinar. That will help increase engagement, and also how positive role modeling starts at the top. So making sure to engage all levels of management to role model in a proactive way, and that will infiltrate through the system and hopefully increase engagement and the leadership.
Yeah, I'd like to add to that. At present, I agree that this is yet another responsibility for managers to look into. But if it becomes more of a business priority overall, and it's established that it's not yet another responsibility, but an organizational level priority, then it could also be tied into performance incentives, which we heard a couple of companies experimenting with. So by using these kind of mechanisms, we can, it's less of a responsibility rather than something that the whole organization is involved in.
Okay, so the two of you have been working on this project for 3 months or more. What I'd like you to do just to wrap us up is, your thoughts at this point in terms of, if you are making recommendations to leaders in this space, where do you think they would benefit most from attention, or where do you think they should be spending their energy right now?
Jenny?
I'll start us off. At a basic level, you just mentioned good management and positive role modeling is a really huge key to success, because you can have the best resources and the largest budgets for benefits, but at the end of the day, if people are not happy coming into work and coming to the office and in a toxic environment, it's impossible to have a healthy workforce. And if you achieve that, you need board level buy-in for this to be a really sustainable effort long term. And I think those are the two biggest things that I would recommend and top of mind. Janani?
I think one of the most important areas that leaders should focus on is also a question that I have at the moment. We keep talking about having a well-being strategy that responds to employees' needs in the present, but are we really anticipating mental health challenges before they occur? And is this something leaders are looking into? So we heard very few companies having a very intentional strategy for responding to return to work or hybrid work environments. And this makes me think that we really aren't anticipating what kind of mental health challenges will take place in the next 5 years as the different type of workforce, which is much younger, enters the companies. So I think there's a lot of scope to anticipate mental health challenges using the data that is available, and put in structural and cultural changes well in time, rather than responding to them in a reactionary fashion later on.
Super. Okay, awesome. So I want to thank everyone for joining us today and for the great questions that came in. I want to thank Jillian and Janani for the great research that they've done. They will have a formal white paper that is a more detailed account of all their findings out soon, and you can look for that on the CAHRS research website. And thanks again to everyone for joining us, and for the companies that helped to fuel this research by participating in the interviews that the students did. So everyone have a great day, and thanks again for joining us.
Thank you.